It's Dr. Morales and partner in crime, Linda Marquez, my patient coordinator. So again, we're continuing with this series of educational, informative videos about plastic surgery and common questions we get. So the question that we're going to answer today is, how soon can I get a body makeover if I'm overweight? Surprisingly, this is not a very uncommon question.
It's not.
Would you agree with that?
Yeah, absolutely.
So, what do you think women are thinking about getting a body makeover most, like within the time frame of like having a baby? When do you think it is?
I think in society now, people are pretty much ready right away.
Yeah.
They're like, I had a baby a month ago. When can I come in and when can I have my surgery? Most people want it right away. And we've had people call that are pregnant at the moment, wanting to know, can I come in now and set up my surgery for after the baby? And I've had the question whether, can I deliver the baby and he do the mommy makeover at the same time?
Yeah. And I agree with that. I think it's usually around having a baby, you're already preparing to get your body back, and you're done with the extra weight, you just want to get it off, and I get that. But the pregnancy thing, you really got to give it time, and it's a very stressful event of your life. You should really focus on the baby and your health, and kind of get back to a little bit of a normalcy to a life of having a new dependent, basically.
Absolutely.
So, with that, we normally wait. You want to give yourself at least 6 months to kind of recover from that event itself, and then you can start planning for that. But women who've gained weight with pregnancy, or just the course of life, just keep gaining weight and just done with it. There are some risks associated to having a higher BMI. That is a fact. That is a fact across having surgery across the board, not just cosmetic surgery. Across the board, there's risk of infection. You can have more problems or an anesthesia experience. You really want to optimize your body to have a surgical event, and you want to be as healthy as you could possibly be. So you don't want to be on medicines. You want to take on blood pressure medication. No diabetes medications.
No smoking.
No smoking, for God's
The big
sake.
one.
No smoking. You want to optimize your health to have a surgery. So, you're going to have a discussion with your surgeon. If you're over BMI over 30, this is going to come up. Your weight is going to come up. Are women having surgery over BMI of 30? Yes. The answer is yes. Is it safe? It can be done safely. You have to understand the risk, but it can be done very safely. There's women who are very, very healthy. I've met women who are BMI over 30, they're marathon runners. I'm not kidding. These people just carry weight differently, and they live life a little bit differently.
Correct.
But it can be done. When it starts getting a little bit higher, you're going to have other manifestations of your health start kind of showing itself. High blood pressure, diabetes, infections, stuff like that. It will come into some kind of factor if you're deciding to have surgery. But if you're really unhappy with your body weight and your body image, please address that first. I think you'll be happier in the long run. So if you want to lose weight, you say, Dr. Morales, I am done being 200 pounds. I'm just done, and I'm gonna lose weight. Please, by all means.
Absolutely.
I will be here when you're ready. But that part, this here, needs to be fixed before you actually have surgery, because surgery is not the answer. It's not a weight loss surgery. And she has this conversation all the time.
I'm so glad you touched on that, because a lot of patients think this is going to solve all their problems. Like, I'll just have surgery, I'll look better, and it's fine. And it's not. It actually complicates things, and it makes everything worse.
It does.
And when you don't go in the right state of mind.
You really gotta. If you exercise, 3 days a week, great, and you're happy with that, and you're not killing yourself to lose all that weight, and you're happy eating 3 times a day, and you're comfortable with that, and if you're happy with that, and I can say, Dr. Morales, I can maintain this for the rest of my life, I'm very happy with my body as it is. What I do is really just kind of contouring, and I will make you look better. There's no question about that. You will look better, but it's not a weight loss surgery. Okay, so you stop looking at the scale. It's how you fit in your clothes, how you feel better about yourself. That's the whole point. Okay, and your results will last longer. Okay, and if you're like at a point where you can't stop eating and you're taking medications, you feel like medications, I've seen that, medications make you gain weight. You stop smoking, you end up gaining like 30 pounds. I've seen that too. But you gotta fix that. You gotta fix that before you go have surgery, because surgery is not the answer. It's not the magical, pill that's gonna fix everything. So some women, have I guess a body mass index just too heavy.
Right.
And maybe gastric surgery is an option. I don't know. Okay, I'm not going to say you need gastric surgery. I think it can be done just with diet and exercise. That's my personal opinion. I'll always encourage that. But there are women who had gastric surgery, and they have it safely and have a very good result, and they made significant lifestyle changes, and that is the key.
That's right.
Making lifestyle changes in what you eat, how much you eat at a time. That is more impactful in the long run as far as your health. And the gastric surgery kind of just stimulated it, so I'm okay with that.
Right.
And the end result's the same. We give back to them, right?
Exactly. Yeah, and the same thing with the diet pills. Diet pills work. They do lose weight, but you get off of them. That's not something you can be on forever. They're not good for your heart. They cause other complications, and so, that's also not the answer, you guys.
That's so true. I mean, I see patients take these diet pills, and yeah, you lose weight for a little bit, but guess what? When you stop, you gain right back.
Yeah, and it's not something you can be on for a long time because of your heart and things like that.
Yeah, have some problems with it too.
Mm-hmm.
So that's kind of the general gist idea of it. So the answer is yes, you can have, cosmetic surgery, you have a BMI over 30, but you have to be very healthy. Accept your body, your body shape, and you're not going to lose a lot of weight with the surgery. And if you feel like you're really overweight and you need extra help, I'll be happy to help you. I can refer you to people who are specialists in nutrition and diet and exercise. I mean, there's resources out there to help you feel better and look better about yourself, right?
Absolutely.
So that's it. Hope you learned something. Thanks for watching.
Thank you.